Hello, everyone. I hope you are all having a great weekend. This is Dr. Iker Leycegui, and I'm making this video to give you an update on what I know so far of the coronavirus, the changes that are happening with the health department and Florida Department of Health regarding the coronavirus infection, changes that we'll be doing in the practice to respond to this issue, and also I need to do some corrections on my last video since we have further information regarding how the spread of the disease happens. So I think it's very important that I let you all know about what has transpired. So first of all, I want to stress that we have to not be panicked. We don't want to scare people out of their wits. We want to scare you into your wits. So we have to make sure you guys are all prepared and to make sure that you take care of your families in this time. So what we have learned so far that's new is apparently based on information I've been reading from the British Medical Journal, and the information is coming out of China. It seems to be that this virus is not spread through secretions like we thought, or that we could just stop the spread with contact precautions, but rather that this virus seems to be from aerosol or airborne. That means that most of our equipment with masks is not going to protect us against the disease. It's simply from breathing. So if you're in close proximity to anyone that has a virus, it's very possible if you're just in a distance where they're breathing, that you could get the virus. Also, this is taken from information that I have gathered from what has been supplied to the primary care physicians in the United Kingdom. In the United Kingdom, they are advising all the primary care physicians not to see patients with coronavirus, since other infections may happen on patients that are waiting in there, and also because the healthcare personnel may become infected. This was gathered also based on information they are supplying, where they instruct that if you have a suspected case of coronavirus, a patient has to be placed in a room, the air conditioner should be turned off, the windows should be opened, and that we shouldn't even enter the room, that any update to the patient should be given by telephone. So based on this advice, I can only gather that the infection is obviously airborne. That would explain why patients in cruise ships were still getting infected even though they were isolated. So this is more serious than what I expected. I did not expect this infection to be propagated through simply breathing, which is airborne. So unfortunately, I do not have any masks in my office. We've tried to get any. We've tried to be getting supplies in order to protect ourselves, but there are no masks available. We don't have at all any N95 masks, which may not even protect for this type of virus. So it is advised that we shouldn't be checking any patient with coronavirus, and I'll touch about this in the near future. So what is the most important thing we need to be doing right now is we need to be testing. I'm really upset that so far it's March 14. We are not testing enough people. The two questions in order to trigger testing are: have you returned from an area where there's coronavirus, such as China, South Korea, Singapore, Italy, and now Europe, which has become the epicenter of the illness? So if you say, no, I haven't traveled to those areas, the next question is, have you been in touch with anyone with a coronavirus? If you say no to both of those questions, then you do not get tested. And this could have serious consequences based on what we have seen, based on the data gathered from what's coming in from South Korea and the data that's coming in from Europe. In South Korea, they have been testing like crazy. They test around 10,000 people every single day. So far, I have friends that work in emergency rooms. They don't have test kits. They don't have a way to check if someone has a coronavirus, and this could have catastrophic consequences. Not trying to panic anyone. Simply, we need to push to get testing, testing, testing. The best way to, since there is no therapy for this virus and no precise antiviral. It's only symptomatic and dealing with any side effects from having the disease or ongoing medical problems caused by the virus. It is crucial that we discover who has the disease, test as many people as possible, because the reason why I don't want you to panic is because most people that will get this virus will not have any problems. As a matter of fact, based on the data we have gathered, most people will just have subtle illnesses, subtle symptoms, which include headache, little cough, having fever, and of significance is if you have just those mild symptoms in the first 3 days, that's where you're the most contagious, and nothing may happen to you, but you will spread the disease to someone else who may have some comorbidities, which means some other medical problems that could get them in a lot of trouble. So, who are these people that could have a lot of trouble? It's going to be the elderly, smokers, patients with diabetes mellitus, um, patients with heart disease, lung disease. So, why is so important to test? Because if you test, you know who has the disease. And in my, say, for taking me for an example, if I check myself and I realize I have the coronavirus, I am not gonna come home, kiss my daughter, kiss my wife. I would not be sleeping in the same bed. I will not be using the same silverware or I wouldn't share a glass of water with them, of course. Also, I would prevent my mother-in-law to come over and see my child and my wife, since she could become infected, and later my mother-in-law could go to her house where she is taking care of two elderly parents that have cardiopulmonary diseases. Those Her parents could get infected, and what would be the outcome? Most probably they would go to the hospital. And in that case, there's two people. Okay, now multiply my story times, I don't know, 1,000, 5,000, 10,000. Then you have 2,000 cases or 10,000 cases coming to the hospital. Yes, we live in the first world. Yes, we have the capability of taking care of very ill patients, but not 10,000 at the same time. The number of ICU beds is very limited in the county. It's very limited in the United States. So the mortality rate would go up secondary to that. So in order to keep the mortality rate very low, we need to ensure we do not get the very compromised infected with the illness, especially at the same time, which could happen with how virulent or how easy this virus is spread. So we need to protect as well our healthcare providers. We need to protect our families. We need to protect the healthcare system, because if we get our healthcare providers ill, then no one is going to be able to take care of the patients that become ill. So, so it is very important that we keep testing everyone to ensure this does not propagate. Also, we need to institute, after testing everyone, which includes safe testing, not only for the patient, because you don't want to come in thinking you may have the coronavirus, and then because you thought you had it, then you get it there. So we have to institute a safe place for patients to get tested. We need to find a safe way for the healthcare providers to test for the virus. What has been implemented in South Korea is a drive-through system where, with tarps in parking lots, like, say, for example, here in our county, we could do it in Walmart, Target, You could do it in the hospital parking lots. You could just drive through, lower your window. A guy with a hazmat suit where he's totally protected could take a swab of your throat and nose, and afterwards, run the tests in a safe manner. That way, you get notified if you have the coronavirus and protect your family and protect the spread of disease. That's what they've been doing in South Korea, where the mortality rate is the lowest. So we need to have that in order to be able to quarantine. At least I think 10 days would be good based on the data we have received. And we also uh, have some social distancing, which means avoid gatherings, avoid crowded places, especially with how hard this has been spreading. Some countries like Italy, the whole country has shut down. I don't think this is feasible because we still have many months left on the, say, even the flu season is still has some time left. Get your flu shot if you haven't gotten it, please. Um, so, I mean, this could be ongoing for a couple more months. So we need to really, really get this under control. At the same time, the whole economy would be catastrophic if the whole economy gets shut down. It's very important, like I was saying before, that our healthcare system is preserved. If we get nurses ill, if we get doctors ill, then they cannot take care of patients. And that's my next point. My priority is not checking patients to see if they have coronavirus or not. My priorities are controlling someone's blood pressure, draining an abscess someone who they may have, dealing with abdominal pain, dealing with urinary infections, someone with some other medical problem. If I divert all my resources to checking for coronaviruses, we're gonna get all infected, and I'm not gonna be helping much. So we need to push the health department to please test everyone. This is crucial. We have not been testing enough people, and that's number one. Then we cannot fight this if we do not know where it is, and the way we fight this is by isolating and treating every case, and that's not going to happen if we're not testing everyone. Also, anyone who's in contact with someone who has coronavirus should be quarantined, and hopefully we can get control of this now. You have to stay calm. You have respiratory symptoms, please eat well. If you smoke, stop smoking. If you drink, stop drinking. Healthy diet. You need to follow a very healthy lifestyle. Also, make sure we have seen an association with improvement on the ACE2 receptors with vitamin D. If you're low on vitamin D, please take it. I usually check for vitamin D, so you all know your levels. We do know that the virus propagates through the ACE2 receptor, which we have in the lungs, we have it in the heart, we have it in the kidneys, and we have it in the intestine. And that is a reason why when this virus infects you, it could affect your heart, it could affect your lungs, or it could affect your kidneys. That's why it's very important, that you watch for any symptoms. If you're having just a mild disease, which most people will get, it's going to be the headache, the fever, chills. You're going to have a cough, some congestion, runny nose. Where you want to be watching is for any shortness of breath, or if you have significant chest pain, that could be that your heart is getting inflamed. There's no specific therapy for the virus either way. So you only want to go to the hospital if it's really, really necessary, if you're really short of breath. Otherwise, you should try to take symptomatic relief, and hopefully the virus will pass. But it's crucial that you don't spread it to someone else that may get in trouble. Regarding the practice, I'm gonna be seeing patients that don't have respiratory symptomatology. So whenever you call in for an appointment, my girls will check if you have any respiratory symptoms, since I want patients to be safe coming in for management of other medical problems and not get infected. Also, we will take care of you, but we're gonna have to do it through telemedicine. So if you have any respiratory symptoms, you need to let us know and we will set you up for a telemedicine visit. Please stay safe out there and spread the word. If you have any questions, leave them in the comments. Subscribe, tap the notification bell so you know exactly when my video is coming out. And I'll be talking to you guys later. Stay safe. Ciao, ciao.